Howdy, how are you? I am Ryan Liberty, and today I'm going to answer the question, what is generalized anxiety disorder? Let's find out.
Ooh, ah.
So let's get to what generalized anxiety disorder is. But first, I have an important thing to say here, which is that this is not the official diagnostic criteria for generalized anxiety disorder, and it should not be used to diagnose yourself or someone else. Only a trained professional should be doing that for you. This is merely a small description of what's going on when we have generalized anxiety disorder. So again, because of that, it's not the diagnostic criteria, and it should not be used to diagnose. If the label of generalized anxiety disorder in any way makes you feel stressed, makes you feel uncomfortable, and doesn't aid in your healing in any way, then just drop the label. It's not necessary to use it. It's only meant to point you in the direction of what may be going on in your life or the life of somebody else that you know who may be undergoing some stress. So with all of that said, I've got my notes here to make sure I'm giving you proper information about this disorder. Generalized anxiety disorder is characterized by excessive and uncontrollable anxiety over a variety of things, typically throughout your day. It's something that's been going on usually for 6 months, approximately, at least. And it's a chronic anxiety, worry about all kinds of different things as you go through life, basically. It's more than most people would experience. You know, we all have those little worries here and there about, did I forget to lock the door? Did I pay this bill? You know, those are normal anxieties that pop up in our day-to-day life. Somebody with generalized anxiety disorder is really concerned about a large number of things, and it often one anxiety leans into another, and it becomes this cascading avalanche of anxiety that they're constantly wading through. So the anxiety seems hard to manage. That's a characterizing feature of generalized anxiety disorder. It just seems like it's difficult to get under control. And it's important to note that this diagnosis, although these are not diagnostic criteria, but it's important to note that when we're looking at generalized anxiety disorder, we're looking and noticing that the things that we're experiencing cannot be explained by another mental disorder. Because if they are, then either there's a comorbidity between the two, or generalized anxiety is not the prominent situation that's going on for you. Now, there is treatment for generalized anxiety disorder. It involves psychotherapy, very often cognitive behavioral therapy, and you can use medication to manage the symptoms, such as antidepressants, SSRIs, and SNRIs, as well as benzodiazepines. So what does it feel like having generalized anxiety disorder? In the body, obviously you're going to experience all of the things that somebody experiences when they have anxiety. So in this case, they're very tired, fatigued, muscle aches. There could be sweating, soreness, trouble sleeping is a big feature of this, poor sleep quality. You may have headaches, trembling, and you may actually feel like you need to use the bathroom a lot because there's so much nervous energy inside of you. Cognitively, what's going on in your head is it's very hard to concentrate with all this anxiety in the background, and you might find that sometimes your mind just goes completely blank. You're often anticipating things that are going to go wrong, so concerned about daily things. What if I forgot to lock the door? And something that happens is chaining when we have these worries. So your thoughts begin to chain. What if I forgot to lock the door? And what if somebody gets into the house? And what if they steal my jewelry? And what if they wreck the house? And what if the insurance doesn't cover that? And what if, and then you see how one fear leads to another fear leads to another, and they stack on top of each other, and that anxiety just magnifies and becomes intense. Now, emotionally, there's a lot of worry You feel on edge, very irritable. You dread that something's happening or going to happen to you. You feel very tense. And often, because you can't control all of these symptoms, there's a feeling of shame or embarrassment that you can't get it under control, and you feel like you have no control over your life. So it's very distressing to go through generalized anxiety disorder. And behaviorally, you may find that there's some perfectionism in your life, and it's centered around generally your behavior is centered around not being tolerant of uncertainty. Uncertainty just causes more anxiety and makes everything feel harder to deal with. So you try to manage that by doing things such as seeking reassurance from other people that things are okay or that you're doing things right. You also may check things very often, so checking to make sure the light is off, checking to make sure that you put your keys in your bag, like a lot of checking behaviors. You may seek information and gather information and keep lists. You may look for distractions very often to try to take your mind off of the anxiety and off of the thoughts that are going on in your head. You may avoid things that cause you anxiety. So modify your life to keep away from those things that you know are going to make your anxiety worse. You may refuse to delegate responsibilities to others because you feel like you have more control, and then you won't get as anxious if things don't go the way that you expect. You may feel that you procrastinate a lot, again, because a lot of those what-if scenarios running through your head. And you may feel more comfortable when other people make decisions because there's so much pressure when you make a decision to get it right and to make sure that things are handled correctly, that you're afraid of the repercussions and you're afraid of the anxiety that results from that. So all of this comes from generalized anxiety disorder. It is a tough situation to be going through. There are treatments, however, and it is a normal experience. So with all of that said, I hope that I've given you a well-rounded perspective on what it is, and I thank you for being interested enough to join me here and learn about it. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments below because that would really help me out. If you find that you're stressed trying to achieve your goals, I have a free tool for you today that will help you get your goals done, so click to get that. And if you'd like to see the rest of my videos, click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.